Hello, hello. We already see some nice warm greetings in the chat. Go ahead and feel free to introduce yourself, say hello. Yes, tell us where you are in sunny, fresh Toronto. Thank you, Ron. Yes, tell us where you're from, what organization you're with, whatever you'd like. Hello, Jacob.
Great to see a diversity of folks on the call. India, Cameroon, and Manila, Venezuela, all coming in here. That's great.
Look at that, Nairobi. Look at this. Wonderful. Please go ahead and just let us know who you are in the chat. Malawi. Hi, bless you.
So we're going to go ahead and get started here in just 1 minute. Just some quick Zoom notes. I know we are all Zoom experts at this point, but please, if you are interested in simultaneous interpretation, there is a globe at the bottom. Most of you are familiar with this. You can select your language of French and Spanish. Please let us know if the translation is not working. Please put it in the chat. I'm happy to back channel that with Haley. And then we are recording this event in all 3 languages. So we'll post that after the session if you can't stay for the full 90 minutes. And lastly, please keep yourself on mute unless you are speaking. We will have a chance to have people raise their hands and have a conversation later on the session, but we're going to start with some presentations and don't want to get too distracted. Love all the chats coming in just around the world.
I think that's
awesome, guys.
Fantastic. I'm seeing so many familiar names and friends. Thank you so much for joining.
All right, Jan, I will hand it over to you and I will stop sharing.
Great. So I'm going to stop grinning here at all the wonderful people that I'm seeing that are putting their greetings and hellos in the chat. And I'm going to go ahead and get us started. So let me share my screen. Just 1 second here. I'm not sure if hopefully you're seeing the right screen.
No, I see it in the, can you go ahead and do it in full screen?
I'm not sure why it's duplicating. Hello, hello. Just 1 second.
Technical difficulties. Starting out strong.
First one, starting out. This is the way it is. Well, I'm glad that we're among family and friends. How about that, huh? Okay, here we go. Let's see. All right, here we go. So, good morning, good afternoon, good evening to everyone. I want to welcome you all to the Washington Healthcare Facilities Community of Practice Initiative. We're so very pleased to have all of you join us today. I want to introduce myself as well as our team. I'm Joanne McGriff, Assistant Professor in the Department of Global Health within the Rollins School of Public Health here at Emory University. And I'm also core faculty within the Center for Global Safe Water, Sanitation, and Hygiene. I have with me Lindsay Denny, who many of you know, who has been affiliated with the Rollins School of Public Health for many years, and most recently was the Senior Health Advisor for Global Water 2020. Lindsay is now working with Emory to support the reimagined community of practice, given her role in the earliest iteration of the initiative in 2018. I also have with me Haley Elling, who leads and manages the coordination and logistics of all of the details of the community of practice, including working with our steering committee and development of all of our future community of practice sessions. And so what you have in front of you is a slide where I want to share about just a short introduction on what the community of practice is, where we started, what you can expect, and certainly how you can get involved. And so one of the first things I want to share with you is that the community of practice idea and concept is not entirely new. It's really an outgrowth of several previous initiatives that has become even more urgent as we all address issues of WASH, IPC, and safe care in healthcare facilities during the pandemic. The concept of the COP began in 2018 during a monthly webinar series where, again, we have many of the folks who used to be a part of that, where our research and learning team here at the Center for Global Safe WASH at Emory encapsulated and shared over a decade's worth of learnings, experiences, and partnerships that we had within the WASH and healthcare facility sector. The desire at that time was to move the conversation of washing healthcare facilities out of scientific symposiums and other sort of closed door meetings into larger spaces where the community of practitioners, policymakers, donors, technical advisors within both WASH and the health sector could really begin to participate in and be a part of what was going on and understand where we were within the sector. Now, the webinar series lasted only 12 months and became dormant in 2019. The next really important component of how this community practice has emerged really revolves around the sunsetting of the advocacy and facilitation group known as Global Water 2020. Again, many of you are also familiar with GW 2020. After spending about 3 years delivering tremendous impacts within the WASH sector on policy, implementation, as well as financing of WASH and healthcare facility efforts, the organization sunsetted in June 2021. However, partners both at Emory, GW 2020, and many other organizations knew that there was just so much more to do to keep the growing WASH and healthcare facility community together, to keep us well informed, and moving towards that common vision of seeing sustainable WASH services in healthcare facilities globally. And there was nothing that brought this need to light more than the impacts of the COVID-19 and implications for overloaded healthcare systems, facilities worldwide. Really what I think we all recognize that COVID-19 exposed our need to prioritize and take action to address deteriorating and sometimes non-existent WASH infrastructure that is so foundational, what we say fundamental to the practice of proper infection control and prevention. And so the mission of the Washington Healthcare Facility Community of Practice initiative is for us to be an action-oriented platform and community of practice. We want a space to be able to share experiences around the issue of WASH and healthcare facilities, and we really harness all of our efforts around 3 main objectives. One is what we call connect, right? So we want to connect in-country WASH and healthcare facility implementers with the evidence, the resources, maybe potential partners, funding mechanisms that we are aware of or that the community is aware of that they may need to develop, implement, as well as advocate for WASH and healthcare facility programs. We also want to share. So again, being from an academic institution, the issue of learnings and not just didactic material, but more about the experiences, ideas, what we know to be the best practice for WASH and healthcare facility programming. Having a platform and a space to be able to share that was so critical for us. And then, of course, encouraging action. It's one thing to have discussions and to deal with problems, and some of that we'll do within the community of practice, but it's another thing to take action. And that's really sort of the heart of what it is that we want folks to walk away with when we are within our in-person sessions or with any of the other materials that you have. How can you use it to move this from discussion to implementation? So in a nutshell, the vision of the community of practice is for us to propel this discussion out of the confines of meetings and conferences and into a space where practitioners, researchers, policymakers, advocates can work together, again, operative word together, to improve WASH and healthcare facilities more rapidly. Now, who is the community of practice? Right? And so we say that all are welcome. So we have a couple of categories here, but it's certainly not exhaustive. NGOs, academics, faith-based organizations, donors, government officials, members of the private sector from across the WASH and health sectors are invited to participate in the community of practice. Now, to expand our reach, we will do all that we can to make interpretation services available for as many of our sessions as possible. We will also seek to host events entirely in languages besides English, again, just to make sure that our messaging, our learnings, our resources are able to spread. Another strategy we have is to connect with other relevant associations, platforms, networks, even other communities of practice, such as what we have here, Quality of Care Network, to increase the spread of, again, what we're talking about here and some of the sharings and things that we have access to. So what can you expect from this community of practice? Well, we are planning and have ideas around at least bi-monthly live sessions like what we have right now. There's some opportunities for webinars, perhaps workshops, use of videos and pre-recorded interviews or podcasts, as Lindsay loves. And the focus really will be on topics that require further discussion among the community. Things that are central to our work, what it is that we are dealing with, some of maybe challenges, even opportunities, and just sort of those salient topics that are important at the moment, really. We'll try to do everything we can to maintain regular communication via the listserv, and that'll include information about upcoming events, updates, and even new resources. And then where we will live is a page on the WHO, UNICEF, WASH, and HCF.org website, which hopefully many of you are already familiar with. We're going to have a page there, and then all of the materials, resources, whatever it's shared during these sessions will be housed on the resource tab of WASH and HCF.org. So again, just converging and making sure everything is consolidated in one space so that you can be part of all the richness that at least WASH and HCF has to offer beyond the community of practice. So a little bit in terms of leadership around the community of practice, Emory will act, at least for this first year, from October 2021 to October 2022. We'll act as the secretariat, where we will work on developing the framework. We're, for instance, running the launch event for today. And then with input and guidance from our steering committee, which I'm going to talk about in a few moments, we'll be responsible for organizing events and opportunities for learning exchange and sending out updates and resources to keep the community members informed. As I mentioned, our steering committee a few times before, we just want to take a moment to acknowledge the members of the committee and the various organizations that they represent. So you see we have participation from a diverse group of organization and leaders within Washington Healthcare Facilities, from CDC to UNICEF, Save the Children, PATH, UNC, Hilton Foundation, Engineers Without Borders, HCF, Africa, CHA Platform, Terre des Hommes, AMREF. Again, just a wide group. And just to tell you a little bit more about the steering committee, they're a group of 10 members of the Washington Healthcare Facility community who've taken particular leadership on Washington Healthcare Facilities. They have and will participate in planning calls, respond to questions, provide recommendations for both topics as well as format, and then give us feedback on past sessions. So they're the ones really sort of keeping an eye on what we're doing based on their perspective to make sure that we're moving in the right direction. Their term is for about a year, so they began in late summer and then will move with us through October 2022. And really, why do we need a steering committee? Well, because Emory University cannot and should not do this work alone. We need experienced, energetic partners who can provide the necessary thought leadership around Washington Healthcare Facilities to help make sure that our approach is balanced, inclusive, and represents the perspective of multiple stakeholders, regional interests, and topical areas. So we need their ideas. And so before I leave you, I just want to make sure that you are aware of our basic principles and how we sort of just what are the fundamental beliefs that we have here as a group in terms of how we'll be structuring and the kinds of conversations that we'll be having within the community of practice. What we believe as a group and as a steering committee is that WASH is a fundamental prerequisite for quality care within a healthcare facility. That there cannot be effective infection prevention and control without adequate WASH. Hands down, period, end of story. There is no debate as to whether or not it needs to be invested in. Absolutely, it's fundamental. We also believe that Washington Healthcare Facilities is a solvable issue and that it'll require multiple systems, sectors, stakeholders to work together to see sustainable improvements, but it is possible. And that is really what is the exciting component of this action-oriented platform, is to harness all of our collective energy, understandings, insights, experiences to get at solving this issue. And then, of course, just our openness. The community practice is open to all who want to learn and share about Washington healthcare facilities. We welcome everyone with all of your diversity of perspectives to participate in this work. So lastly, how do you participate? So this is a few examples of ways you can get involved. There are many, many more, but certainly just want to make sure that you and others that you know of subscribe to the listserv so you can receive the updates on events, what we're doing, how to join with us in sessions like this, as well as other elements that I talked about that we'll be sending out. And then send us topic recommendations. So many, many of you are sitting in positions, organizations, regions that are dealing with particular issues that may become really important for the entire community to have, to wrap their minds around and to have discussion. So we want to know and hear from you what you're dealing with and potentially topics that we can use in future sessions. And then of course, we always want to know, how do we talk about success? It's one thing to contend with the challenges and try to put our brains together and solve problems, but sometimes every now and then we need to have a success story. And so we are really imploring you as a community to go ahead and send us ideas, big or small. Tell us what is happening that's good. Highlight successes, wins, things that are going on in the Washington Healthcare Facility community in your region so that we can share it with the larger community and people can have access to just different ways that Washington Healthcare Facilities is moving forward. And so with that, I'm going to stop sharing. And for a few moments, I'm going to ask members of our steering committee, at least one of the members, we're going to first share a video, I believe. It's just a few seconds, just tells us a bit about work that some of the members of our steering committee are involved with, and then we'll hear from one of our members for just a few moments. So I'll pass it on to Haley, I believe, to share the video.
Jennifer Alobo is a 23-year-old mother who had her second baby 12 hours ago at the Kaladima Health Center 3. She did not deliver her first child here because delivery facilities and services were very poor. But a lot has changed. The maternity ward is newly renovated and very clean. The services are much better, and she's happy she attended antenatal care and also chose to deliver from here, near her home.
No, the place is now good because there's light, water, good latrine, everything is okay. They welcome us good way, in a good way.
We have one more video, and we can put the links to the full videos in the chat. We just want to show you a snippet and remind folks what it is we're working towards.
वॉश इन हेल्थ और एनआरसी कार्यक्रम की शुरुआत की गई। इनमें 9 जिला अस्पताल, 55 सामुदायिक स्वास्थ्य केंद्र, 108 प्राथमिक स्वास्थ्य केंद्र और 24 उप स्वास्थ्य केंद्रों में स्वच्छ एवं सुरक्षित पेयजल सुविधाएं, मल की सुरक्षित निपटान एवं हाथ धोने की समुचित व्यवस्था, जैव चिकित्सीय अपशिष्ट प्रबंधन और संक्रमण नियंत्रण का आकलन करके 196 स्वास्थ्य केंद्र के प्रभारी अधिकारियों की क्षमता संवर्धन कर विस्तृत कार्य योजना भी तैयार की गई। वॉश इन हेल्थ और एनआरसी कार्यक्रम के तहत राज्य के 1700 से भी अधिक स्वास्थ्य कर्मियों को प्रशिक्षित कर अस्पतालों में वॉश का कॉम्प्रिहेंसिव असेसमेंट किया गया तथा पाई गई कमियों को दूर करने के लिए शॉर्ट टर्म, मीडियम टर्म एवं लॉन्ग टर्म में बांटते हुए समयबद्ध कार्य योजना तैयार की गई।
कैप टूल और उसके माध्यम से बहुत छोटे छोटे से गैप्स जो थे वो निकाल कर बताए।
Great. Thank you so much, Haley and Lindsay, again, and for the great work. And thank you for our partners for sharing those videos. And so now I just want to turn it over to one of our partners, Vandana Bhatia, a health specialist for UNICEF India office from Madhya Pradesh. Vandana, would you go ahead and share with us just why you joined the steering committee and what you hope to get out of this?
Thank you so much, Joanne, Lindsay, the Emory team, my fellow committee members, for having me as a member of the steering committee. And thank you so much to all my India colleagues from the WASH and Health team and the Madhya Pradesh Chief of Field Office for giving me the opportunity to be part of this wonderful, steering committee. We are all aware that, and Joanne's presentation also highlighted the need for WASH in healthcare facilities. The video from Madhya Pradesh was a snippet into our little work that we have done together with the WASH and health teams to strengthen, WASH and healthcare facilities. I'm joined by many of my team and members from India Country Office, Dr. Ali, the WASH colleagues, Pankaj and Nagesh, and Bhagwan, and all the government partners who have enabled us on this journey to strengthen WASH practices at the health facilities in Madhya Pradesh. We are aware that the SDG goals 3 and 6 cannot be achieved without the convergence of WASH and health. Unless we all come together to ensure that health facilities can get strengthened, the human resources are skilled to practice WASH behaviors, the operations and maintenance is possible by leveraging local funds and donors. And we are also the recent Global Health Hand Washing Day. The theme was health hygiene for all. And my personal interest and professional interest in WASH is triggered by our culture. And when I say our culture, if any of us have visited somebody's home or a hotel, if we want to stay in, our customer satisfaction index or our human satisfaction comes from the fact that the bathroom and the kitchen is the cleanest facility that is there. If we can keep our hotels and worship places so clean, why cannot we keep our health facilities clean? And why cannot we save our maternal and newborn mothers and newborns from dying? Because we know that at least 20 to 30% of mothers and newborns die due to causes related to sepsis. Every newborn progress report by the UNICEF has also highlighted that point of care at quality WASH includes WASH interventions. If we have to prevent infections, we have to improve bio-waste management practices. If we have to reduce and rationalize antibiotic usage, then WASH interventions and strengthening health systems, making them WASH resilient is the way forward. So my interest in joining the community was definitely to share and get the community of practice voices from our governments, our partners who are helping us in this journey to make each facility become WASH resilient, minute by minute. As we speak, we have 190 facilities in Madhya Pradesh today which are WASH resilient. And we have a long way to go as a community of practice. I'm sure many other country members who are here today, many other committee members who are here today are facing similar bottlenecks and similar challenges that we face to make facilities at health facilities, the schools, and even the nutrition centers like the Anganwadis WASH resilient. So we can come together as voices of these communities, voices of satisfied mothers and newborns who are born infection-free, who survive, thrive, and transform into healthy adults and continue to practice healthy WASH behaviors. We can come together and bring these voices, connect together as a steering committee member, learn from each other, and also advocate for more resources, more facilities, more communities, so that we come together and ensure that WASH resilience is not a dream, but it actually happens. And we've seen how it is happening in the most remote tribal, urban, and rural blocks in India. And I'm thankful to many colleagues who are part of this journey. And we've been here more than a decade. We've come a long way from supplying hand pumps to actually ensuring that we go beyond hand pumps, we go into utilization, strengthen the behaviors of WASH practice. So here I am, and I hope that this platform will bring us all together bring our voices together. It's our platform, our voices, our chance to advocate for WASH practices, and look forward to being part of the committee, look forward to being part of the WASH community of practice. So all the best to all the fellow committee members and the WASH community of practice, and look forward to bringing a healthy, robust discussion and learning in the coming term to be able to serve you and bring your ideas and help you to learn from each other. Thank you so much, Joanne.
That's perfect, Vandana. I tell you, every time I hear Vandana, I get so excited. And certainly, again, she really is just the epitome of all the other steering committee members in terms of the energy, the passion, and the drive that she brings to this. And I'm so grateful for you. And thank you so much for sharing your thoughts. We do have another steering committee who unfortunately could not join us today, but I just want to say really quickly on behalf of Adam Jolet from PATH, who has independently launched a chlorine generation community of practice, which again, many of you may be aware of. And so that community of practice will be working alongside us as a subtopic within Washington healthcare facilities. We see this as an important work, an important group, and we look so forward to linking up and aligning our work together with Adam and the folks involved with the community of practice around chlorine generation. So again, that's just another opportunity to have groups of individuals thinking about Washington healthcare facilities in really thoughtful ways come together within this community of practice as well. So thank you to Adam. Just wanted to pause really brief. I don't know, Lindsay, if you can let me know any questions or comments as it relates to anything we've shared thus far around the community of practice, the introduction.
Sure. There's some thoughts coming in the chat, and please feel free to either raise your hand or to ask a question or make a comment or put it in the chat. We've set aside some time here to let you kind of sort this out. It's I'm sure first time many of you are hearing about this, but some notes here, some questions about the steering committee, how to become involved in the future. I think to get this launched, we had to pull together a group, but in the future would love to have nominations of steering committee members down the line. This is supposed to be something that's co-owned. It's not an Emory initiative. There's a reason we don't have our logo on anything we do. This is owned by the community. And we are just here to help get it started. So certainly would love more engagement. If you'd like to take more leadership, please reach out and we can find ways to get you involved. But certainly your thoughts are always regardless welcome. When Joanne and I did the community of practice, or the webinar series in 2018 to 2019, we'd send out an email saying, send your thoughts on topics, and we'd receive silence in response. So part of the reason of the steering committee is to help make them feel responsible to help us get the best content out there and have the best discussions. There's also some comments here from Maggie Montgomery. Thank you so much, Maggie, for joining from WHO. She's got some great thoughts on new topics, such as how implementers are jointly addressing Washington energy, as well as climate smart, environmentally sustainable approaches to Washington healthcare facilities. Also, this issue of budgeting and financing, how do we get over that barrier, discussing what that looks like from an implementer's perspective in particular. And then also reaffirming that we need to work with these other health community practices. And that's why we have folks like Vandana and other health colleagues who are part of this. We can help connect up. Would love to co-host a quality of care network and a Washington healthcare facilities session, have discussions with our colleagues. I think that'd be wonderful. A couple other thoughts on here. Question about the decentralized chlorine production community practice. I will have Adam send the information on how to join that. We'll certainly co-share their information. Anytime they have an event, we'll make sure you all are aware, but there might be a direct link to their listserv I can send out. And then we will also share some information on how to get on our listserv. Any other questions? We'll definitely share the PowerPoints. Financing is a big challenge. We'll definitely make sure that's a discussion. I know it's not always the sexiest topic to talk about, but certainly one that's been limiting. I think that's all I have for now. Any other questions? Anyone want to raise their hand and make a comment?
Lots of things going on in the chat. Thank you so much for putting your thoughts in there.
Maybe while we're thinking here, Joanne, do you mind if I go ahead and launch the poll? We want to know who you all who are invited. So I will go ahead and put this out here. Apologies, I couldn't translate it entirely into French and Spanish. So if you are unable to choose your response, feel free to type it in French or Spanish in the chat. We'll make sure to capture that. But let me go ahead and put this out here. All right. So we have 3 questions we want to hear from you. Joanne, you want to go ahead and get them off here, get us going here?
Sure. Thank you so much, Lindsay. So, as Lindsay said, we want to know who we have in the room, if you will. So, if you would, go ahead and check off, and you can check off as many as you'd like. What sector do you represent? So, health, WASH, IPC, or other. And again, we may have some chat work we ask you to do. Number 2, what do you hope to gain from this community of practice? We have some options here, and certainly we have the other box. Connecting with fellow members, diving into topical issues, or receiving resources and updates. And again, if you select other, we may ask you to drop a few comments in the chat. And then lastly, how would you like to engage? So we mentioned and rattled off some options as to how we can engage with you, but we'd like to hear from you as to what is preferred. So webinars, discussions, workshops, pre-recorded interviews, videos, things that don't require live participation. Email newsletters, and then of course we have other that we will ask you to give us some insight on. And so Lindsay just dropped in the chat that if you haven't already joined our listserv, where you can receive our updates and announcements, there's a link there in the chat. So go ahead and complete that, or send that out to folks who you think may be interested as well. So we'll give you another 30 seconds or so. We got about half of the group responding, or a little more than half.
If you're saying other, please feel free to throw in the chat what you mean by other. Super interested what other ways to engage means. We have a few folks saying that. I'm always open to ideas. Webinars are a bit tedious at this stage. So if you have other ways to engage, that is very interesting. Also, what else you want to gain from the community of practice? I see a few folks have said that. If there's something else that we should be making sure takes place during this, let us know. All right, Jim, and maybe we give folks 2 more minutes, or sorry, 20 more seconds.
Yeah, well, 20 more seconds. Yeah, let's do 20 more seconds. We got about 70% participating already. Let's see if we can get a few more people to respond for us, and then we will close it out. So another 10 seconds. Thank you. We're already seeing some other comments coming in. Appreciate that. Oh, blogs. Yeah, nice idea. Okay, 5 seconds, and then we'll close it out.
3, 2, 1. All right, I need to pull it down. Let me share the results.
So, and it's an interesting conversation that we will have in terms of who we have in the room. We see 80% have identified themselves as WASH people. We have a good chunk of people, also 31% is health, 18% at IPC, hello to our IPC friends, and then we have 8% other. And if the other group would like to go ahead and just drop in the chat, what sector do you represent? That would be helpful for us to know. So go ahead and do that. And then we have, what do you hope to gain? So humanitarian, okay. What do you hope to gain from the community of practice? And, I just lost my sharing, there we go. So, oh, good. So we have 66% who want to connect with fellow members of the community, but even higher percentage, 76% want to dive into topical issues and hygiene, issue of sustainability. Equally high percent, 75% want to receive resources and updates. And then we have a nice chunk, 7% or so, who mentioned that they have other interests in terms of what they hope to gain. So go ahead, if you haven't already, tell us what it is you think the community of practice could be a good source for what else for you. And then the last question, how you want to engage. The highest rating we have is 80% would like to have webinars. So there we have it, Lindsay, webinars.
I'm so sorry, I was trying to get away from webinars, but you all make it difficult.
We are not fatigued yet, not about this. And so webinars, 80%, we have roundtable discussions at 72%. The next one actually is email newsletters at 66%. And then we have pre-recorded items at 37%. So this is, again, really good information for us to have. And I know a couple of people have already put in other ideas of how to connect with you. in the chat. If you want to continue doing that, go ahead and do so. But again, we're going to take this all back to the steering committee and really kind of think through how to accommodate some of the preferences that we have here. And so,
oh, sorry, go ahead.
I think the last question we have is, and I think we have some of this from earlier on when everyone was putting in their greetings. We'd like to know, what country are you from? So if you don't mind indulging us a bit, even if you already sent your greetings, could you just put into the chat box, what is your country of origin? And we have, okay, great, they're coming in, Guatemala, Suriname, US. Take about 30 seconds or so and just let us know, what is your country? Great, Canada, Kenya, Ethiopia. Wonderful, Venezuela, wonderful.
Fantastic. And just a note here on commenting on how we'll engage. I think, thank you for those thoughts. I saw a couple of thoughts in the chat about collective advocacy, joint advocacy, about sign-on letters, about communications. So lots of other ways to engage through this process. So we'll take that back. But as we mentioned in the presentations, our goal at the moment is to provide every other month a live session, whether it be a webinar, a roundtable discussion, something that requires dialogue, that isn't just something you can watch on your own, that the whole point would be coming to the table and talking to your fellow community practice members. In the meantime, in the month that is technically our off month, we will seek to send some sort of pre-recorded something. Could be a pre-recorded webinar that's just a learning session, could be an interview with someone like a facility director. Vandana actually had the idea of doing a healthcare facility tour. So I don't know how we will figure this out. It's going to take me some time, but we'll do a walkthrough of a healthcare facility and look at some of the challenges and maybe some of the improvements. So these are all ideas we have that we will do in the near future. Other than that, as you have ideas of things you'd like to have happen, maybe you don't have the bandwidth, shoot us an email and we'll see if we can gather together a group to have a conversation about these topics, whether it be in French, translated, etc. We are not on a total shoestring. We do have somewhat of a budget, so we will try and offer you as many resources as possible. And just a note here about country level chapter for the community, country level chapter for the COP. We are interested in knowing how we engage at the country level, and this is something we've talked about. So we'll have to figure out what, I know there are some groups that are already engaged. I believe Uganda has a community practice that's kind of active on Washington healthcare facilities. So we'd love to do some interaction there and not just keep this at the global level. So Joanne, I think we are good here. Did we lose Joanne here? No, she's there.
I am here.
Here we go. I lost your video. I don't know where you went.
Okay, I'm still here though. And I think I will actually pass it on because I think we have come to a place where we want to take, if we don't have any more questions, just take a little 2-minute pause.
Yes. So Prakash, your question here, just a quick note about if you want to contact about sharing experiences. Do you mean share experiences? If you want to share experiences with us and make it broader, we can certainly, you can certainly send it to me. I'll put my email address in the chat box and I'll send out a note later on, or WNHCF action at emory.edu. Action is easier to spell than initiative. That's why we have that email address. We don't want anyone sending the email to the wrong place. So but if you would like to try and get other colleagues around having discussion around your experiences and sharing experiences, we'll talk about how best to do that. We don't plan on having a discussion board. I think that's hard to moderate, but we will look at ways in which we can share amongst each other. So give us just a bit of time to determine the best way for that, and if that's something you're interested in doing. But Haley, if you want to go ahead, we're going to take a pause here. That's the end of our intro to the community of practice. The next half of this is about really jumping into topic. I think we said number one was people wanted to talk about topical issues. Today we're doing that. We're going to talk about hand hygiene since Friday was Global Hand Washing Day. Let's have a discussion around hand washing in healthcare facilities. So this actually was a little bit quicker than we anticipated. So we'll take the 2-minute break now and we'll come back at 9:41. So if you'd like to go to the bathroom, grab a sip of water, go for it.